Well, here we are with Dr. Marion Shuler Holliday at Shuler Vet Clinic, and today we'd like to talk about physical rehabilitation. Dr. Shuler Holliday, please tell us about what you know about physical rehabilitation.
Sure, of course. Usually when clients ask me, what is this? I basically explain it. I liken it to human medicine. If you have a hip replacement, a knee replacement, spinal surgery, your doctor is going to make sure that you go through with some physical therapy because, you know, you go through the surgical procedure and that's a large part of it, but, you know, the rest of the battle is regaining muscle strength and function of those body parts that have been worked on. So it's very important to follow up and follow through with that. So if people do that, doesn't it make sense for our pets to do that as well?
Well, it sounds like if you go through the expense of surgery and
Absolutely.
don't follow up, it's just a waste of money in some instances.
Absolutely. Your pet most of the time could be fine, but you're going to get more function, better longevity, better use of that limb or back or whatever has been worked on if you go through some rehabilitation.
Happier troopers.
Happier troopers, more comfortable troopers, less pain.
All right. Well, when would you use it? You know, when would I want to use it on my pet?
Okay. I personally feel like there are two main goals of physical rehabilitation. One would be increased function. So you've hurt your knee, you've had surgery, you've hurt your back. We want to get you to the point where you can use that limb again. Whether you're going to be a couch potato dog or whether you are an agility dog, field trial runner, we can increase the function. The second main goal is to decrease pain, whether that's pain from a surgery, pain from an injury, or pain from osteoarthritis if you have a geriatric dog. The main goal of treating a dog with arthritis is to decrease pain.
Right. Well, do all the veterinarians in the area do this, or does it take some special training, or?
It does take some special training. There's a pretty intensive program that I went through. My certification is a certification of Canine Rehabilitation Practitioner, and so that was a program I went through over the course of almost a year.
And you get certified in that?
I do. I get certified. I have a nice plaque with more letters. So.
Great. Could you tell me then? Are there special equipment that you have to use? Major groups or just
Sure.
moving dogs around?
Well, it kind of runs the gamut. There are a lot of exercises that I can use just my hands, and I can teach clients to do that at home. That's going to be important. If they come into the office for treatments, but it's important to do treatments at home as well. Then we also have some specialized equipment: therapeutic ultrasound, neuromuscular electrostimulation, underwater treadmill, land treadmill, lasers. There's kind of sky's the limit with a lot of the procedures. They're constantly developing more and more because this is such a cutting edge. It's an important thing, and there's a lot more research going on currently.
So this isn't just taking your dog home and walking him after surgery.
Right. There are definitely some specialized equipment, and it is a commitment, but after you've spent the money on your surgery, or you have your 12, 13-year-old dog that you love, it's a commitment to helping him or her be more comfortable and be able to move around better.
I like the sound of it.
Yes.
Could you show us briefly one of the things you do?
Sure, of course. Okay, here we are with Sandy. You can see the scar on her leg. She had an old cruciate ligament injury, and she has had surgery for this. That has it's an ongoing healing process, but we have reshaved her knee, and just so that we can show you placement of the electrodes for the neuromuscular electrostimulation. These are just little sticky pads. And so the goal of this is to kind of surround the area that we want to be treated, and we're going to send electrical waves through the tissue here. There we go, thank you. We're going to send electrical waves through the tissue, and this serves a couple of different functions depending on what your goal is. It is helpful for decreasing pain. It is also helpful, if you can help me keep those on there, please. It is sometimes helpful if there's a lot of swelling or edema. It can help to decrease that. And for dogs that have lost a lot of muscle tone, dogs that are partially paralyzed, they can actually help to regain or maintain muscle strength. Here we go. One more, Sandy. Good girl. Okay, and so we just make sure these are stuck on well. A lot of times we'll wrap it, but just for today we're gonna and you can relax her lip a little bit. There we go. Okay. Carrying on. Okay, and then we just turn on our machine.
Is this just typically a couple second therapy session, or?
Well, we typically run about a 20-minute session, depending on how often the dog needs it. 2 to 3 times a week for a dog with surgical post-operatively.
So this is working.
It is, and so we're not quite at the level yet where we're showing some muscle contraction, but sometimes you can see little muscle quivers happening. We're kind of using it today. We're using it today more for some pain control and to decrease some swelling, as opposed to getting some involuntary muscle contraction. And so that you can see that this isn't painful to her at all. A lot of dogs, it actually feels good, and they're happy to come in and lay down, and we say, okay, it's time for your treatment, and they'll lay down for their treatment, because it does feel good to them. They know that when they're done, they are in less pain and they're able to move around a little better.
Well, thank you. That's great.
Absolutely. So she's happy to lay here and get her treatment and be a good dog that sheds a lot. I don't know if you can see that.